Good morning, students. Today we will continue talking about effective communication in a healthcare setting. And the topic for today is feedback to a patient. The famous coach, Eric Parslow, said, "Feedback is the fuel that drives improved performance." However, giving feedback is not an easy task. To gain skills, everyone should know what the main barriers to the feedback are. Two of you were assigned to prepare a presentation today about the barriers to effective feedback. Viljas and Vavia, can I ask you to share your insights with the class?
Thank you, Professor, for giving such an interesting assignment to us. Dear colleagues, hopefully you will enjoy our presentation and find it useful for your future career. Various factors actually can impact on effective feedback and act as barriers. Our presentation is based on the review by Georgia Hardavella and colleagues. The first barrier I would like to describe is generalized feedback that is not related to specific facts and does not give advice on how to improve behavior. Generalized feedback is unhelpful and can be confusing. The person receiving feedback remains unclear about the actual purpose of the session and usually starts exploring hidden agendas that might have triggered the feedback. It disrupts relationships and causes unnecessary suspicion.
Another barrier to feedback is a lack of respect for the source of feedback. We all tend to accept feedback more from people we value. In the opposite case, it is advised that you ask another colleague that was present to provide informal feedback rather than doing it yourself, as otherwise this might impact on relationships and the feedback will be ignored.
The healthcare professional giving feedback might be different from the patient in terms of gender, age, social status, and educational and cultural background. These factors may result in a demotivating feedback session. Therefore, feedback needs to be given in a supportive, empathic, and relaxed manner, and upon a background of a relationship based on mutual respect.
Poor handling of situations in which the recipient is resistant or defensive can result in a dismissive approach. Therefore, the feedback will be disregarded.
Giving feedback loudly in a noisy corridor or in the presence of another patient is inappropriate. Such feedback loses its objectivity, and the recipient may consider this as an insult that will impact their institutional relationship with the healthcare provider.
Language and cultural barriers convey unclear messages and result in unclassified assumptions. It is important to confirm the message sent is the message that is received. All feedback sessions should be held in a respectful and supportive manner.
Personal agendas should not influence feedback. As soon as you realize that this might be a possibility, it is best not to give feedback, as this will be perceived by the recipient negatively. Personal reflection will identify the reasons behind this and will be crucial in improving this aspect.
A person given feedback who lacks confidence may exhibit shyness, difficulty in being assertive, or lack awareness of their own rights and opportunities.
When preparing to give feedback, think about what you would like to achieve. What do you want to highlight? What went well? And where could there be some improvements?
Planning in advance is crucial to the process. Planning should include to whom you are giving feedback. There is no one-size-fits-all approach. Feedback should be tailored to each individual and the corresponding situation. Thank you very much for your attention.
Thanks, Vavia and Viljas. It was interesting and useful. I'm sure the class has been given something to think about.